So regarding the mechanism of action for larotrectinib, as well as the entrectinib, which is one of the other NTRK inhibitors. Larotrectinib is a pan-TRK inhibitor that basically, it's an oral agent, also comes in a liquid form. It's an ATP competitive binder, which in comparison to entrectinib also not only is a pan-TRK inhibitor, but also impacts ROS1 and ALK. So they are a little bit different. Larotrectinib is specifically a NTRK inhibitor. In regards to the efficacy and the safety for larotrectinib, in regards to the efficacy, the response rate is quite impressive. The response rate the last time that I reviewed the data was 81%, with a significant number of patients in PR and CR, obviously. And then in regards to toxicities, there were no significant major toxicities, I think, that we would consider of concern, especially for grade 3 and 4. In the other studies, however, for entrectinib, there was some grade 3-4 toxicity in regards to fatigue that were noted, and some other non-specific toxicities such as dysgeusia. In regards to duration of response, from what I've gathered from the data, is that there is significant duration of response, and it's very, for the majority of patients. And this obviously can be pivotal in patients that have had refractory metastatic disease. This patient is unique in the sense that she is treatment naive. However, the majority of patients with surgically unresectable disease will need to continue chemotherapy or some type of treatment indefinitely. Therefore, it's really imperative from my perspective that all patients, number one, should be tested for MSI high, but as well as for the NTRK fusion, because this provides them a different unique opportunity for continuum of care rather than just a standard systemic chemotherapy. So in that aspect, I would say that this drug is, and this class of drugs is really pivotal for, especially for our patients in the refractory patient population that have been through multiple prior lines of therapy.